Our next speaker is Nancy White, Chief Executive Officer and member of the board at Inagene Diagnostics. Nancy has held a number of senior executive level roles in the pharmaceutical industry and has worked at Novartis Pharmaceuticals, Novartis Oncology, and Eli Lilly. Welcome, Nancy.
Hi, it's a pleasure to be here. Thanks for having me.
It's so great to have you here today. And I have to tell you, last week was in my church group and we were talking about mental health and someone I knew who was going through some mental health struggles. And one of the women actually messaged me after and said, you know, you should try this company, Inagene. My daughter's a nurse and she swears by it. And I was like, that's very serendipitous because I'm actually going to be speaking to Nancy next week. So I'm so excited to have you on the couch across from me because I have a ton of questions for you.
Great.
So the first question is, what is a pharmacogenetic test and how is the testing done?
That's a great kickoff question, and I'm delighted to hear that you heard about this randomly, just through your affiliations and associations. But pharmacogenetics is simply the science of how does your body respond to medication, full stop. And when you think about genetic testing, a lot of people immediately will think of lifestyle testing, things like what is my ancestry or why is my hair a certain color? Or they think about the other extreme of genetic testing, which is all about disease diagnostic and predisposition to certain conditions. So what this test simply looks at is how your body will process a medication and how you might have a different response than, say, I would to a certain pill.
And why would someone want to get this test done? So my doctor prescribes me medications. They seem to be working. So why would I want to get this test done?
Yeah, that's an important question because today we're talking about mental health and brain health. And right now, during these times of the pandemic, we're seeing a tremendous increase in anxiety, panic, depression, and they make sense because of the trying times we're in. What often happens is we'll go and see our healthcare professional and they'll prescribe a medication to us. And in the area of mental health, it is notorious for what this approach is called trial and error. So the doctor will listen to your symptoms, they'll write a prescription for you, you'll go home and try it. After a couple of weeks, you might not be feeling better and you pick up the phone and say to your doctor, hey, I need to see you again because I'm not feeling better. And so you go see the doctor, you talk about your symptoms, and they'll say, okay, maybe we'll try a new one. And so this process can be really drawn out and long, and this is what they call trial and error. By using a simple genetic test like this, which is saliva, nothing more, it's not invasive, you can find out how your body will respond to that medication. And response is more than just does it work. Response is, will I have side effects? Do I need more of it? Do I need less of it? So it's really complex how our amazing bodies process something, but by doing something as simple as a cheek swab test, you can find out which medications are not going to work for you, which will work for you, or some that you need to have special considerations with. And so one of your previous speakers was speaking about SSRIs, and SSRIs are a very common class of antidepressants. If you looked at my report, I can't process SSRIs. They're all do not use red medications for me. So knowing that, I feel sorry for those individuals who try that type of medication and it just doesn't work when there are answers to help you understand whether or not you should even begin that medication.
That's really powerful information to have, and it's something that I'm sure a lot of people don't even know we have access to. And so is there a specific type of person who should be getting this test? Is there an age group, a gender, or is it just for everyone? Like, can my 13-year-old take the test?
Well, we like to say the best time to take this test is before you use medication ever. Right. So you know what you're doing before you try it, but that's not practical because a lot of people don't even know this science exists. Yeah. And so if you are currently taking a medication, if you're planning on taking a medication, it's any time is really great for you. But if you're struggling right now and on something that isn't working for you, this is just another piece of that puzzle of who you are uniquely to help you understand that maybe this isn't the medication you should be on. We talk about a wide spectrum of ages, and for a lot of your Zoomer audience, they're probably taking care of elderly parents who may be in long-term care, for example. The statistic in Ontario is that most long-term care residents are on more than 10 medications. That's a lot. And sometimes those medications can conflict with each other or cause further side effects or challenges. So really at any age is the appropriate time to take it. But if you have a surgery coming up, why wouldn't you want to know which pain reliever would work best for you in advance?
And so you've spoken about mental health drugs and pain relief. So what types of mental health conditions or non-mental health conditions can pharmacogenetic testing help with? How often do you say that word in a day, and how often do you say it improperly?
It's rolling off your tongue very well.
I'm
so
actually quite impressed with myself, because when I was going over these questions, I was like, pharmacogenetic.
I hear lots of pronunciations of the word, but you've got it nailed. So any condition really, we do have a signature specialty test that's focused in pain and mental health. And so anyone who is needing a medication for pain or mental health, we do recommend that. It's very robust and goes very deep into the genes that are known to have gene-drug associations. But if you have cardiovascular issues, or you are taking any kind of medication for pain relief, or I'm drawing a blank, of course, at the moment, but we cover more than 22 areas of drugs. So our general panel would be better suited for any other type of condition. But for pain and mental health, we do strongly recommend the dedicated pain and mental health panel.
And so the test is called Precision Pain and Mental Health. I looked this up. So what does pain have to do with mental health?
So when we first started the company, we were looking at all the disease areas that are out there and looking at the science of pharmacogenetics to see where the evidence is the strongest. One of the big areas where there's tremendous unmet need is pain. And we all know someone who has got, back pain issues or lower back issues. Anyone who's experienced pain acutely, that it becomes chronic pain, the comorbidity or the co-association of mental health is such a strong overlap. Most people will have some of both. And if you think about it, if you have chronic pain, and let's say it is lower back pain, you're nervous about when the next flare-up's going to happen. When the flare-up happens, you're not going to feel great because you know you're going to be either laid up or in bed. So the comorbidity of, if you have pain, you might have a mental health condition, or vice versa. The overlap is really significant and tremendous. And sometimes these medications are used to treat in both areas. So having those in-depth insights into pain and mental health together provide a really clear picture to help the healthcare professional and the individual decide what's best for the patient.
So Andre from our audience actually has a question for you. So he is wondering if the results of the Inogene test will change over time. So if I, at my age now, take a test, should I take one 5-10 years from now? Like, can the results change?
So technically, no. Your DNA is your DNA. So when you're born, that's it. You've got what you've got. And when you take our test, it is a one-time test. So you may not need a medication today, but maybe in 5 years you need one. Your results are still valid. Where the test is changing is that this research is emerging and growing in its amount of evidence. And as new gene-drug associations emerge, we'll continue to add those to the test. So we review our report and update it 2 times per year at no charge to the individual. And over the last 20 months at Inogene, we've added more than 22 new medications to our report. So it's important to continually be on top of the emerging science, because as new evidence emerges, there will be new medications that we have more concrete evidence about in terms of how your genetics will impact your response.
So I want to talk about the medications a little bit, and not like all the medications, but
we'd be here a while.
I'm just thinking, so I know how important your relationship with your family doctor is. And so I'm assuming these results, I would take them to my family doctor, or they're sent to him. So what does it, and I'm saying him because my family doctor is a male. So what does he see? Because there's so many medications out there. So is it grouped by classes? Like, what is my doctor looking at so that he knows what works for me?
That's a great question. So the report is very easy to use, and our language is really driven to the consumer level so that anyone reading it can understand what it means and what to interpret from it. We absolutely encourage an individual to take the test results to their doctor. Your doctor knows you best. They know your history, they know past experiences, and it's a powerful tool to help them in your treatment journey. We never say that it's the be-all, end-all. It's just one piece of kind of that treatment paradigm to help support informed decision-making to make sure the individual's getting the best possible care. The other feature that is really handy within our report is a lot of customization that you can employ yourself. So your doctor is not going to want to see you bring in a 200-page report to them. They're going to look at you and say, thanks, but I don't have time to read this.
That's what I imagined was like
Yes.
this booklet. I'm like, here's what works for me, doc.
And it happens, and I'm sure there are plenty of doctors going, yes, please do not bring me that report in. With the functionality built into our report, you can very easily, within seconds, customize a report of any drug you've previously been on, drugs you're planning on taking. You can do searches by things, as you pointed out, like the drug class. It's sorted alphabetically. There's lots of search functionality to make it very easy for you. And then you don't even have to print it out. You can actually email that condensed version of the report straight to your healthcare professional so that you don't need to intimidate them and have them angry at you as you kick off your appointment.
Although I do kind of want to do that just because I do want to see his face, but I won't do it, I promise. So I, just linking back to our last speaker, I noticed there's a cannabis component to the test.
Yeah.
So what does that mean? Can you tell me a little bit more about that? As I said earlier, I do consume a lot of cannabis to help me sleep, and so is it going to show me something about myself?
I think you should try the test. So our test looks at 27 genes and 52 variants of those genes to help you look at, as an individual, at what your response to cannabis might be. And response, again, means a lot of different things. One of the speakers spoke about the endocannabinoid system that exists within our body. And so there's, method of intake. Should you smoke? Do you take an oil? There are longer-term consequences that can be linked genetically to long-term use of cannabis. But what our test will help you do is, if you're cannabis curious, you've got lots of friends who've talked about it and you may not have tried it, it will give you a reasonable starting point that will work for you. So, for example, in my profile, I should avoid THC. I'm more prone to the psychotropic side effects that people can experience, and on the same hand, I'm also what's classified as an ultra-rapid metabolizer of CBD. So if I took what my friend might be taking, I might not have any result from it whatsoever. So it's really to help you guide your decision making. And with cannabis being legal in Canada, a lot of people are self-medicating, if you will, and not telling their health care professional about their use. This report, again, will just provide you with more information about what you should be considering if you are taking prescription medications as well as using cannabinoids.
See, now I feel bad because my mom always says that CBD affects her more than other people, and I feel like she's just making it up, but it could have to do with her genes, and I should apologize to her right
Yes,
after we finish our interview. I'll say, Nancy said I should say sorry.
Absolutely.
And one question, because this is, honestly, this is such fascinating information that, again, I'm sure most people didn't know they had access to. So I'm going to ask the question everyone's wondering: how much does this test cost?
Yeah, so you can order the test online yourself. You don't need a doctor to recommend it. It's 299 Canadian dollars. A lot of insurance companies are reimbursing it, and it's a very simple process. We'll ship the kit direct to your home, completely private, and your results are accessible through a secure online private portal.
And from when I ship you back my saliva, how long does it take for the results to come to me?
Yeah, so we own our own lab, and our testing turnaround testing time is very quick. It can be in as few as 2 to 7 days, again, depending on when we receive your sample in our lab.
Well, I know what everybody is getting for their birthday this year.
Fantastic.
So before we wrap up, I'm going to ask you the same question I've been asking all the speakers. You're extremely busy. You live and breathe mental health. What do you do for your mental health?
Yeah, I have to admit, through the pandemic, I broke down and bought a Peloton bike, so I have a bit of an unhealthy obsession with my exercise bike, but it's done wonders for my sleep, which a lot of your panelists were talking about the importance of. So I've been fortunate to stick to my fitness regime.
That doesn't seem like a very unhealthy habit, considering my habit turned into extreme online shopping, which
I could join you in that pursuit for sure.
Well, thank you so much. It was so lovely speaking with you today. I've learned so much, and you're going to be getting a purchase from me for sure, because I need this information.
Thank you so much. It was really great to talk with you.
Thank you.